I'm Alexi, by the way.
Hey, I'm Kiernan.
Kiernan?
Yeah.
Nice to meet you.
Nice to meet you.
And what are you doing?
So Tabling for Trust Women, we're a clinic in OKC that does gender-affirming care, school abortions. We can't do that in Oklahoma anymore, so trying to fill in gaps in service where we can.
So what are you doing now instead?
Now we're doing gender-affirming care still. We can't treat minors anymore in Oklahoma, but can still see adults for now. We're doing birth control and like some harm reduction services.
Okay. I mean that was a lot right there.
Yeah.
In a very fast, short, concise way. The gender affirming care was banned. It was banned for minors.
Yeah.
But that was the services that you were providing before that, right?
We for a while were the only clinic in the state doing puberty blockers
Okay.
for trans kids, and we saw quite a few, and then had to cut off services for all of them, or have to cut off starting November 1st.
So what happens to these trans kids now?
I guess, so we tried to refer them to a clinic in Kansas, but Kansas probably isn't like legally safe this session either. There's a clinic in Colorado, is like the closest one, but they have about a year wait to get on their patient list.
So they have to travel
Yeah.
to another state to get the affirming care.
Yeah, if they're able to. We have a lot of kids that are like on Medicaid, and their families don't really have the resources to get them out of state.
So then in that case, they just stop the transition?
Yeah, they're just like cut off of their meds. So they passed this law in May during like our legislative session, and then there was a non-enforcement agreement with the ACLU and the Attorney General that expired, and then the judges they ruled like against it basically. So that was supposed to be a taper period for these kids, but there's not really like a way to taper this care. That's not really like how it works, and legislators like don't understand that and don't care. Yeah, so all the kids have to be like detransitioned basically if they're not able to get out of state.
I mean, was that like devastating for your organization since this was something that you guys focused on?
It was tough. It was hard because we were an abortion provider before, and that became legal in Oklahoma before the Supreme Court decision. So we're already used to like having to move folks out of state for services and like work with all these legal barriers. But it's hard. We're hoping there's not like a state like Medicaid ban on gender affirming care, because then we'll lose a lot more of our patients if they ban that for adults.
Okay.
I know it's bad out here. It's really
yeah.
bad.
Oh, yeah. That's a lot going on for sure. I mean, what do you think is the probability that they could ban the gender affirming care for adults?
For adults, outright not likely, but probably what they'll do is try to pass a ban on using like state Medicaid for it. We see a lot of people that are on Sooner Care, which is our like health care, or whatever, like our state Medicaid. So if they ban that, we'll have to like patients become cash pay. It's the same thing that happened in abortion care. I've worked in abortion care for like 10 years, so it's all kind of the same stuff. So they do like a Medicaid ban, and then folks have to pay out of pocket, and then it just becomes like impossible for folks to get care without assistance if they're not able to get that.
Do you know a lot of people that sort of like moved out of the state after all of these things were passed into law?
The gender affirming stuff, there was a whole thing. So OU is like the big hospital system here with the University of Oklahoma.
Mm-hmm.
They got cut off from their funding by the state at the end of last year. So that clinic had to close. And so a lot of their providers did leave the state. So there's providers that are like staying around, but a lot of folks have left the state, and like a lot of patients have too. Like a lot of the like parents of kids are figuring out how they can leave Oklahoma if they're able to. Oklahoma has like a uniquely shitty legislature. Like you can't come in and comment like you can in a lot of places. Like Florida, there were like trans people like giving themselves their hormones like on the state floor. Oklahoma, you have to be invited to speak with like at the legislature, and they'll just never invite anybody progressive. The politics here are like so conservative that like they didn't really have to justify it. They all just like unanimously passed it basically.
Just because they felt like that was the right thing to do.
Yeah, because it's like a hot political thing to do right now. They can score like conservative points for when they want to run for like state senate or for bigger office. The cruelty is the point. So at some point they just like hate trans people and want to fuck them over, and so they just pass laws that do that.
Like, what do you think? What do you think that hate comes from? Just from like not knowing enough about trans people, like religion. What's the?
I think some of all of it. I think part of it's religion. Part of it's like just the line that they're fed by like the Republican Party nationally. It's like they hear on Fox News that trans people are like scary and whatever, and so they just like internalize that and repeat it and don't really critically think about it, and don't like think about people in their lives that like this could be affecting.
How many minors were you serving before?
I think we got up to seeing about like 20 or so kids, like 15 or 20 consistently. So a couple of them are old enough that probably have enough medication to like make it till they're 18, and then the ones that are younger, like on blockers, hopefully will get to Kansas. Most of them have gotten appointments in Kansas. So
How do you think those kids feel, like being affirmed and being supported by an organization and kind of like being on the way, to transition into someone they want to be, and then all of a sudden having those rights taken away?
yeah, it's been really like devastating for our kids. Like we had to call everybody earlier this month and be like, hey, we have to, like we were gonna try to get them enough like of their blockers, because the blockers usually last for 3 or 6 months for like an injection. So we're like, hey, we can't even do that. Like it feels really shitty and unaffirming. Like you have to have approval from the school board to change your gender marker, like your name and pronouns at school, and they basically said that they're not gonna do that. So I don't know if it's a mandatory report or if like they're just allowed to report it. But if kids are using a different name and pronouns at school and like they have a home that's not affirming, the teachers could like have to report that back to their parents basically, and like it's like a forced outing thing for kids. So it's like they're just getting it from all sides right now. Like they can't go to the doctor and be affirmed anymore. They can't go to school and feel safe. They may or may not feel safe at home. Like it's just like all sides.
So it's sort of like those decisions and those laws are implemented to protect the kids, but then there's the trans kids are the ones that are suffering.
Yeah, because like gender affirming care is so safe. Like there's the long-term effects of not having this care versus like getting it. It's so detrimental to kids that like aren't affirmed and not able to like that go through like the wrong puberty and like can't access the meds that they need. But they don't like they just won't listen. Like the legislature won't listen to like science and doctors and therapists and like providers, or the kids themselves even have like tried to talk and they just won't listen.
I think one of the arguments that I keep hearing about that is that, oh, you're too young to make such a life-changing decision, right? Like, you're 6 years old or 7 years old. What do you know about gender? What do you know about, like committing to something so
like concrete or like permanent?
Yeah, exactly. Like, how do you know that at that age? And I think they're saying like, well, as a kid, you don't know, so that we're like kind of like taking that away from you, that you don't make a mistake and it's for you, right? That's the kind of like the argument, I think.
Yeah. I mean, there's research that shows that that's not true. Even stuff that I learned in like my like shitty nursing school is like kids have a strong sense of like their own identity and their gender. They start learning that at like 3 and 4 years old. So like kids express that from a really young age.
13 and 26.
And like
13 and 26.
the only like when they're young, when they're prepubescent, the gender affirming care you give is just like letting them do whatever they want and like be kids. So when you start a puberty blocker, that doesn't do anything except delay puberty. Like it's not changing anything, it's just like pushing it off so that they don't have to like go through that. And then you can start on hormones. And persistent, insistent, consistent is like what you document on kids. And like we always see that, and especially like the kids we see here, it's so hard for them to get to care, and we have to have like both of their parents in on it. So like by the time they get to care, they've like really expressed this for a long time.
Right. So obviously, in order for them to go through it, they have to have their parents' consent.
Yeah. I think there's a couple of states where if they're like 16, 17, they can get meds without consent.
So basically, the state is taking over the parents, taking over the parental rights and saying, no, you don't really know what you're doing with your kid. This is what you're gonna do because this is what we decided.
Like, yeah, it seems like I want to run to a blue state. Like that seems safer, especially like my spouse is trans. We're gonna probably end up with like a bathroom ban or God knows what this session.
Did you say a bathroom ban?
Yeah, like where you have to use the bathroom that is like if you have male in your driver's license, you have to go in the men's bathroom, and if you're somewhere else, then they like can make it a whole thing. Florida's got that, Kansas has that, a bunch of states are like starting to pass that.
Sure, okay, but if you go through life and you have, you are a trans man and you have a whole beard and then you go into a women's bathroom, how would, the other women feel?
Right.
Who are in the bathroom at the same time?
Yeah.
And vice versa.
Yeah, like none of it's logical, it like doesn't make any sense. But then there's also like, as far as moving, it's like, where do you go? Like the whole country, like there's places that are safer right now, but there was like a woman in California had a pride flag up and somebody came into her store and shot her. Like, I mean, nowhere's really safe.
I mean, what do you think could be a catalyst to like a global, let's say, acceptance of like trans or non-binary people or people who just don't want to conform to like the two gender norms that are kind of like put out there for us? What do you think? What do you think is the move there? How do we get to that point?
Yeah, I mean, it's been there before. Like, there's cultures that have like third and multiple other genders. Countries being colonized, and like white supremacy has done a lot to like put in really rigid gender norms and like enforce a lot of this. And it's what happens in the U.S. too. Is like the police violence. You can't go out and protest because they can just shoot you in the street. Or like the legislatures, like there's so much gerrymandering of like the districts and stuff to like conform to like voting a certain way that like the Democrats keep telling you to go vote, and that doesn't really accomplish anything because they don't do anything either. And it's like you can do like local action, but I think it's just going to be like grassroots, like community groups trying to do